family physician, understands the controversy we were just talking about, like the flu shot was last time he came in. Now we're here to talk about mammograms, which there are so many differing opinions on whether or not we collectively should be going for yearly mammograms. Tell us about the new study and what your thoughts are.
Okay, so let's start with the basics. Mammograms are x-rays of the breast, and we do them to look for early signs of breast cancer. So it's important to know the statistics. In Canada, women have a 1 in 9 chance of developing breast cancer and a 1 in 28 chance of dying of breast cancer. So it's, you know, it's pretty significant. And when we do mammograms, what we can do is catch and detect cancer early so that you can treat it early and reduce your risk of dying of breast cancer. And if you treat cancer early, then you can get less intensive treatment for cancer, so you can avoid maybe radiation or chemotherapy, have just a small lump out as opposed to a large lump.
Okay, so that makes total sense. So why would anybody say not to have a mammogram?
Okay, so there are also a lot of risks that are associated with mammogram. And whenever we do a medical procedure, we have to look at the risks versus the benefits.
Okay, what's the risk?
So some of the risks that we worry about most are false positives and overdiagnosis. So false positive means you catch something on the mammogram that turns out to be not really a problem. It doesn't turn out to be cancer after all. Overdiagnosis means that you catch something that is an early cancer, but it doesn't turn out to be a cancer that would have affected our lifespan or caused any symptoms. But yet, we will get all this investigation for false positives and overdiagnosis that you don't actually need. But the problem is when you catch something, you don't know if it's going to be something bad or not. So we just treat everything.
And it's quite common. It's happened to me that you go in, they go, okay, we're going to just need to do an ultrasound on that.
Right, exactly.
Or we're going to check it. It wasn't a lump that was found, it was a mammogram that found.
Yes, it just found a finding.
Right. And then I went in and they're like, fine, see you in 6 months. And then I'm like, okay, well, now I'm afraid to go back.
Right, exactly.
Right? So I need to know, given both sides of those arguments that you just laid before us, one being obviously 1 in 9 and 1 in 28, and early detection being everything, or false positives and over treatment, where does it fall? Where does the advice fall? Because once you're over 50, yes.
Right.
But I'm not over 50.
Right.
So what do we do now?
So that's why the BC Cancer Society recommended those guidelines. So between 50 and 75, if you're at average risk, then you should get your mammogram every 2 years, or at least that's what they recommend.
All right.
If you're between 40 and 49,
okay, that's me.
Yes, or over the age of 75, then they say talk to your doctor. So what does that mean?
My doctor said go, because I have 3 cancer survivors in my family, not breast cancer, but I have those precursors, all of them, thankfully, saved through early detection, so I'm defaulting towards the mammogram.
Right, so you're actually in one of the high-risk categories. So someone who has had a mother, sister, or daughter with breast cancer, who has a strong family history of breast cancer, who has the breast cancer gene in their family, or who has had chest radiation, then they should go for their mammogram every year. That's
every year, no matter what your age.
That's what BC Cancer recommends, up until 75, and then we look at life expectancy as well.
Oh, right. It's very easy to get a mammogram, too, and it's not painful.
Yeah, and the radiation is very small. People often worry about the radiation. It's about the same amount of radiation you would get from 7 weeks of daily living, just being alive, or a flight to Hong Kong, maybe five round trips to Hong Kong.
Okay, so negligible.
Yeah.
So, in your professional opinion, is there a group that absolutely do not need mammograms?
Well, so between the ages of 40 and 49 and over 75, that's where the talk to your doctor comes in.
Right.
And in those age groups, the evidence isn't as clear. So the benefits do not clearly outweigh the risks for that age group. So that is when you have to look at your personal values. So say you're the type of person who says, okay, I really want any sign of cancer out of my body. If there's any chance that that little thing could be cancer, I want it out. I want all possible treatment, investigation. Exactly. Yes. So if you're that type of person, then you should probably get your mammograms every 2 years starting the age of 40. And that's the maximum you're allowed to get according to the BC Cancer Agency.
Very easily done.
Yes, it's easy. It's just an X-ray.
Screeningbc.ca.
Yes.
One website, great resource for us.
Yes.
And CanadaTaskForce.ca.
Yes.
Second one.
Yeah.
We're out of time, Dr. Lu. Thank you so much. Follow her on Facebook. Ask questions on our Facebook page. Thank you so much for clarifying. You really have brought some light to this subject, because there's no cut and dry answer.
It can be very confusing.
Right. We need to investigate, and we need your brilliance on top of it. Thank you so much.